Hey everyone. Okay, so I'm just making an update. I don't really have a whole lot to say. I still have my surgery date set for October 5th, 2012. I am going to see my orthodontist in less than a month. I'm seeing him, I think, on May 15th. So I have an orthodontist appointment that day. And, what else? Yeah, so last time I went to the orthodontist, as I said probably in my last video, I had the arch wires bent to open my bite again, and I have this elastic here to help, I guess, I think that's also to increase the underbite and to make the top jaw a little bit more retrognathic. I have a feeling there was something else, I just can't remember what it was. But yeah, so that's pretty much what went on last time, but the thing is I haven't really seen a lot of changes in my bite. These are the elastics that I'm still wearing. I don't know if you know, like, there's so many different brands of elastics, but these are like the Fred, so they're pretty thick. And they give me like massive headaches. They really suck. But I'm trying to wear them as often as I can. And yeah, so right now my bite is it still looks pretty closed. Like, my bite was 3 millimeters open originally, and now it's probably less than a millimeter, which isn't really good. That's not what my surgeon wants. My surgeon was like, he said like 3 millimeters or more would be good. So I have a feeling that I'm not surgery ready at all right now, which kind of sucks because I do have my surgery booked for October, and I am not, like, I can't change it. I'm leaving in January, and I need to have my surgery done like soon, early enough that I have a little bit of time to heal and then go away for school. So I'll have to see what happens. But right now, you look, the bite's closed. There's no open bite. So I don't really know what's going on because it's been over a month right now, and it should have been opened more than this, I feel. So, and they said like it's really easy to open the bite and it's like fast, but it doesn't look open at all to me. So I don't know what's going on. But I did email my orthodontist about like a couple different things, and he just said to wait until the next appointment and we will see what it looks like and see if I'm ready to maybe have my surgery moved up, like to maybe be on a waiting list for an earlier date. Because that would really help, considering like I don't really want to go away 3 months after surgery, but like I have to leave for school probably in January or something, and I'm having my surgery in October, so I want to like have enough time that I heal and that you know, there aren't any major problems while I'm away. I'll probably have an orthodontist overseas because I won't be able to have my braces off yet. It'll be too early, so I will probably be seeing an orthodontist in Australia, and I'll have my braces off whenever I get back to Canada. So we'll see what happens, but right now there's not really a whole lot going on with my jaws. Everything's kind of like slowed down. It's been over a year in the braces, so I don't really see changes now like I used to, and right now it's just kind of like the whole waiting thing. Like, originally we were planning to have my surgery around this time, like once I finished my finals, but that didn't happen because of my orthodontist wasn't, my surgeon wasn't happy with the decompensation. Which my orthodontist said happens like maybe 10% of the time. So it was just one of those cases where he wasn't really happy with the way my bite was, and he says that my top jaw is too unstable to do surgery on it. So it kind of sucks. The headaches have been really bad. My TMJ pain has been really bad. I find it's worse at night. I find I'm good when I'm sitting down, but as soon as I lie down, it's just like my jaw won't close properly, so it kind of just sits on one side or the other, or if it's pushed back, and it's so painful, and that's when I get the worst headaches, and I have a lot of trouble sleeping, and I wake up with really bad headaches too, because a lot of times, like, I'll try to fall asleep on my back even though I shouldn't because I had sleep apnea. I try to fall asleep on my back because that way my jaw doesn't fall to one side or the other, but I wake up like on my side and then my jaw is just killing me. I did have a lot of breathing problems. I don't know if any of that will be fixed with the surgery, but I did have, a few years ago, I did have sleep apnea, and I was waking up like not being able to breathe all the time, and it was always when I was lying on my back, so I kind of have this fear of falling asleep on my back, but it's kind of like, it's such a trade-off now where I'm just like, what do I do? I haven't had the problem with the sleep apnea in a really long time, so it's been okay. Like, I'm hoping it doesn't happen again. But yeah, that's pretty much that's pretty much it. I don't really have a whole lot to say because not much has really changed. I'm hoping that, you know, like, I'm hoping that next time I go in, maybe, even if we can just make some other changes to help my bite maybe open a little bit faster, or to make it, I don't know, just to get it where it's supposed to be, I'll be happy, because that's already May, and then I only have May, June, July, August, September, October. That's only like 5 months till surgery by the time I go in, so I'm less than half a year away from surgery. And I know I've been saying this for so long because I thought my surgery would be now, but it's not. But yeah, so it's actually, I'm sure it's gonna sneak up on me really quick. When I got my surgery date, which felt like yesterday, it was over 7 months away. So 2 months just went like nothing. But yeah, I just want to say thanks to everyone else who's been like blogging or who's been visiting my blog and been commenting on my videos, and who has posted videos, because it's been so helpful just to like have the comparison and have people to like see what they're going through and see how surgery worked out for them, and just to have so much support. It's been really awesome because it's really hard for people to really understand what it's like being a jaw surgery patient. It's not like a typical surgery where it's like, you know, a knee surgery where it's like, oh, you need to get something done to your knee and you have to wait like maybe a couple months for surgery. With jaw surgery, it is a pain. It takes forever. Like, first of all, you're in braces, which sucks because it's your face, and then you're waiting like usually a year, sometimes over a year. I know people who've waited over 2 years for surgery, and you know, and all that time you're having your bite changed. It's really uncomfortable. It's painful. Your face starts to change because of like the way everything is sitting. So it changes the way your face looks, and then surgery changes the way your face looks, and surgery is a huge recovery, and then usually you're in braces for at least 6 months after surgery, and you know, you're not completely healed for a really long time, and you're really swollen. So it isn't like a traditional, like typical surgery where it's just like in and out. It's like, this is like a huge process, and it's kind of like a pain. It's really emotionally straining. So just to have people to talk to who understand what it's like, it's such a huge help, and I'm so grateful for that. But yeah, I will update again when I find out what's happening, or if I see my orthodontist. And I'm really hoping that, you know, everything gets better. I hope my teeth move or continue to move, because right now they look pretty similar to where they were before. I'll try to take some pictures and compare, because I don't even know, like, I look at them every day. But yeah, I'll let you guys know, and yeah, I will update when I find out more. Okay, bye guys!